All right. Welcome to week two of Applied Biomedical Statistics. I'm Dr. Dennis Spence, and I will be giving the lecture this week. All right, our week two learning objectives are my goals are that you'll be able to evaluate critically the experimental and observational study designs and methods found in research literature, as well as we're going to learn about methods for ensuring validity and reliability of measures. After you've gone through this lecture, I'd like you to watch a few videos on YouTube that I found that I think will help reinforce some of the concepts that I talk about in this lecture. Each of these videos is nice and short, and I think you'll enjoy them. These next two are optional. If you have a little bit more time, you certainly can look at them. They get into just a little bit more detail about indexes and scales and surveys. Certainly not required, but if you have some time, take a look at them. So what is a research design? Well, a research design is really it's our blueprint or our map for how we conduct a study. It helps to, depending on how we design the study, and the type of design we use, it really helps us maximize control over factors that may interfere with the validity of our study findings. We're going to talk about that a little bit later, as well as increasing the probability that our study findings accurately reflect reality. And that can sometimes be challenging when we're doing human subjects research. And so what is study validity? Well, it's really just a measure of truth or accuracy of a claim. And the validity of a study provides the basis for allowing us to make evidence-based decisions. That's how we can, when you read an article in, say, an anesthesia journal, maybe it's on a new pain medication or a new medication to treat postoperative nausea and vomiting, you need to be able to critically appraise that article and understand the findings and be able to determine if there are any what we call biases or threats that could have potentially impact the internal validity and the external validity, and we'll talk about that a little bit later. A design with strong internal validity minimizes what we call the bias, and this allows the researcher to really isolate the effect of the intervention, or in this case IV is the independent variable, on the outcome, which is the dependent variable. If you remember to last week, we talked about those concepts. And a bias is just a means to slant away from the truth. So there's a couple important concepts that you need to understand. Causality is really is the criteria that a variable, for example, an independent variable, causes an effect each time it occurs. And when we look at randomized controlled trials, those are the strongest study designs that are really trying to get at cause and effect. However, there's a lot of what we call extraneous or confounding variables or biases that can make it difficult to infer causality. Probability is really what we're dealing with, is because it is difficult in human subject research to prove causality. We're really dealing with probability. That and that's when you read terms in an article or in a discussion conclusion where authors are using terms that such as results may be related to or associated with, rather than using the term that it proves. With study design, and one of the characteristics especially of randomized studies or experiments, is that we have a treatment or intervention, and that we manipulate the variables under study, and we examine their effects on the outcome or the dependent variable. We also have control, which is having power to direct or manipulate factors to achieve a desired outcome. And certainly stronger designs have more control and minimize bias. So bottom line is, the more control, the more credible the study findings are. However, there is a caveat to that and some weaknesses. I've mentioned the term a bias, And a bias is just a systematic error or deviation from the truth in results or inferences. And you can read there, there's a number of sources of biases that can impact or decrease the validity, or I would say the believability, of findings from a study. For example, maybe how the researcher executes it, how the subjects are sampled from the population, the type of measurement tools. Are they valid for measuring what you're wanting to measure? Are they reliable? Subjects sometimes can sabotage studies. They don't always follow the instructions. They sometimes will miss appointments or follow up data collection points. Um, there may be some bias in how we select people into a study, as well as how we collect data and the type of statistics we use. And strong research designs can minimize these factors. Some elements that are central to a study design is one is there's a presence or absence of a treatment, and this is most common in experimental designs. How many groups there may be in a sample, the number and timing of the measurements. Maybe you're only taking a single measurement in time, or maybe it's a longitudinal study where you're taking multiple measurements over weeks, days, or years. How we choose a sample from the population, what our planned comparisons are, and how do we control or minimize confounding or extraneous variables which may interfere with our study and interfere with our conclusions. There's some important questions that the next couple slides go over that you should think about as you're reading a research manuscript or an article in a journal, that can help you when you're appraising the literature. So what's the primary purpose? Is it to describe or observe? Are they examining relationships? Or are they making predictions? Or are they testing differences and examining causality? So it's really important as we get into some of the later lectures, we'll talk about some of the statistical tests. And it's very important that when you're critically appraising literature, that there's a linkage between the purpose statements and the methodology, as well as the statistical tests that are chosen. For example, if you're saying I'm testing differences between two groups, then that would lead me to believe that I'm looking at interval level data, and maybe I'm looking at not interval level data, but I'm looking at differences between the groups. So say, for example, if I'm looking at the effects of a new pain medication on postoperative pain, and I randomize patients to a treatment group or a placebo group or control group, and I measure their pain score on a visual analog scale, then I may be using what we call a t-test to test the differences. And so we'll talk about that in later weeks. What type of treatment or interventions will be used? If so, will the researchers control the treatment that is given? Will the researcher take baseline measures before the treatment? Will the sample be randomly selected? Now there's a difference between random selection and random assignment. Random selection is where you have a population and you randomly select from that population. Random assignment is where you're randomly assigning subjects or volunteers to one or more groups that you're studying. How many groups are you studying? What's the size? Is there a power analysis that's been conducted? Is there a control group? We already mentioned randomization. Is there blinding, meaning are the subjects blinded? They don't know what group they're in, or also do double blind. Also, the investigators or the data collectors could be blind to what group they're in. How often will the variables be measured? Is data collected cross-sectionally or over time, meaning cross-section meaning a snapshot in time, or longitudinally or over time? Have extraneous or confounding variables been identified? How will data be collected on extraneous variables? And we'll talk about that later on. What strategies are being used to minimize those effects? When you're ready, start with the next